1. A dog presents with pale mucous membranes, weakness, and rapid heart rate. What is the most likely concern? Dehydration only, B. Anemia or significant blood loss, C. Normal stress response to veterinary visit, D. Overheating from exercise. When restraining a cat for a physical examination, the most effective and safe technique is to A. Scruff the cat firmly and suspend it in the air. B. Use minimal restraint with one hand supporting the chest and controlling the head. C. Wrap the cat tightly in multiple towels immediately. D. Hold the cat upside down to calm it. 3. The primary purpose of the capillary refill time (CRT) test is to assess A. Neurological function, B. Hydration status and peripheral perfusion, C. Respiratory rate, D. Body temperature regulation. 4. When administering subcutaneous fluids to a patient, the needle should be inserted A. Perpendicular to the skin at 90 degrees, B. Into muscle tissue for faster absorption, C. At an angle into the subcutaneous space, typically over the shoulders or back, D. Directly into a visible vein. 5. In adult learning theory, veterinary assistants learn most effectively when training A. Is purely lecture-based without hands-on practice, B. Connects to practical job applications and real patient scenarios, C. Focuses only on memorizing medical terminology, D. Avoids any discussion of actual cases. 6. Normal rectal temperature range for an adult dog is A. 97.0 to 99.0 degrees Fahrenheit, 36.1 to 37.2 degrees Celsius, B. 99.5 to 102.5 degrees Fahrenheit, 37.5 to 39.2 degrees Celsius, C. 103.0 to 105.0 degrees Fahrenheit, 39.4 to 40.6 degrees Celsius, D. 95.0 to 97.0 degrees Fahrenheit, 35.0 to 36.1 degrees Celsius. 7. When developing a training curriculum for new veterinary assistants, Bloom's taxonomy helps instructors A. Schedule lunch breaks appropriately, B. Create learning objectives, progressing from basic knowledge to higher order thinking, C. Determine student tuition rates, D. Select the color scheme for training materials. 8. A client calls reporting their cat ingested lily flowers 30 minutes ago. The veterinary assistant should A. Tell them to monitor at home for 24 hours. B. Recommend inducing vomiting at home with hydrogen peroxide. C. Advise immediate veterinary attention as lilies are highly toxic to cats. Suggest giving milk to neutralize the toxin. 9. The 5 rights of medication administration include all of the following, except A. Right patient, B. Right medication, right color, D. Right dose. 10. Effective formative assessment during veterinary assistant training allows supervisors to A. Assign final certification scores only, B. Monitor skill development and provide corrective feedback during learning, C. Eliminate the need for any final evaluation, D. Reduce required training hours. 11. Proper dental formula notation for an adult dog indicates they have A. 28 permanent teeth, B. 30 permanent teeth, C. 42 permanent teeth, D. 32 permanent teeth. 12. When mentoring a new veterinary assistant, the most effective approach includes A. Expecting immediate independent performance on day 1, B. Providing structured shadowing, hands-on practice with supervision, and constructive feedback, C. Only allowing observation without any hands-on experience, D. Criticizing mistakes without offering guidance. 13. An animal is described as being in lateral recumbency. This means the animal is A. Standing on all 4 legs, B. Sitting on its hindquarters, C. Lying on its side, D. In a head-down position. 14. When communicating with anxious pet owners about their animal's condition, the veterinary assistant should A. Use highly technical jargon to appear knowledgeable. B. Minimize their concerns and dismiss their emotions. C. Speak clearly, show empathy, and provide information the veterinarian has authorized. D. Make independent diagnoses and treatment recommendations. 15. The abbreviation CIDE or QD on a prescription indicates medication should be given. A. Twice daily. Once daily. 3 times daily. D. Every other day. 16. According to Knowles' andragogy principles, adult learners in veterinary assistant programs A. Require constant supervision without autonomy. B. Are self-directed and bring valuable life experience to training. C. Learn best through repetitive memorization only. D. Should not participate in goal setting. 17. When collecting a urine sample via cystocentesis, the technique involves A. Catching urine during natural urination. B. Using a sterile needle to collect urine directly from the bladder. Inserting a urinary catheter. D. Expressing the bladder manually. 18. Regulatory compliance for veterinary assistants typically includes A. Performing surgery independently. B. Following state veterinary practice acts and facility protocols. C. Prescribing medications to clients. D. Making medical diagnoses without veterinarian oversight. 19. A dog presents with acute vomiting, diarrhea, and refusal to eat. These are signs of A. Normal behavior requiring no concern. B. Gastrointestinal upset or systemic illness requiring veterinary evaluation. Typical aging process. D. Attention-seeking behavior only. 20. Summative assessment in veterinary assistant certification programs is best used to A. Monitor daily progress during training. B. Evaluate overall competency at the completion of the program. C. Replace all other forms of evaluation. D. Track only attendance records. 21. The proper technique for venipuncture in dogs typically uses which veins? A. Femoral artery only. B. Cephalic, saphenous, or jugular veins. C. Abdominal veins exclusively. Tail vein only. 22. Zoonotic diseases are those that A. Only affect exotic animals. B. Can be transmitted between animals and humans. C. Only occur in zoo settings. Are not preventable. 23. When creating competency-based learning objectives for veterinary assistant training, objectives should be A. Vague to allow maximum flexibility. B. Specific, measurable, and directly related to job performance. C. Focused exclusively on theoretical knowledge. D. Identical for every learner regardless of experience. 24. An autoclave is used in veterinary practice to A. Store medications at proper temperature. B. Sterilize surgical instruments using steam under pressure. C. Refrigerate vaccines. D. Warm intravenous fluids. 25. Proper personal protective equipment, PPE, when handling potentially infectious materials includes A. Regular street clothes only. B. Gloves, protective eyewear, and appropriate gown or apron. C. Just hand sanitizer with no gloves. D. No protection needed for veterinary staff. 26. In constructivist learning theory applied to veterinary training, knowledge is best acquired when learners A. Only listen to lectures passively. B. Actively engage in hands-on experiences and reflect on practice. C. Avoid any collaboration with peers. D. Memorize facts without clinical application. The term NPO on a patient's chart means A. Normal post-operative care. B. Nothing by mouth, no food or water. C. Needs pain medication. D. New patient observation. 28. Professional boundaries for veterinary assistants include providing medical advice outside the veterinarian's direction. B. Working within scope of practice and deferring medical decisions to veterinarians. C. Diagnosing conditions independently. D. Prescribing medications based on personal judgment. 29. A cat is displaying piloerection, flattened ears, dilated pupils, and hissing. This indicates A. The cat is happy and relaxed. B. The cat is fearful, threatened, or aggressive. C. Normal, friendly greeting behavior. D. The cat is sleepy. 30. Scaffolding in veterinary education refers to A. Physical equipment in surgery suites. B. Temporary instructional support adjusted to the learner's current skill level. C. Permanent teaching methods never modified. D. Construction safety protocols. 31. When calculating drug dosages, a veterinary assistant must A. Estimate amounts based on visual assessment. B. Use precise mathematical calculations based on patient weight and prescribed dose. Always use the same dose for all animals of the same species. D. Round to the nearest whole number, regardless of prescription. 32. Chain of custody for laboratory samples requires A. No documentation needed. B. Proper labeling, tracking, and documentation from collection to analysis. C. Verbal communication only. D. Samples can be unlabeled if collected quickly. 33. When developing assessment rubrics for veterinary assistant skills evaluation, criteria should be A. Subjective and vary by student preference. B. Clear, objective, and consistently applied to all learners. C. Hidden from students until after evaluation. D. Based solely on speed rather than accuracy. 34. Proper positioning for a lateral thoracic radiograph requires A. Animal standing on all four legs. B. Animal lying on its side with affected side down, legs extended. C. Animal in sternal recumbency. D. Animal positioned vertically. 35. Continuing education for veterinary assistants serves to A. Generate revenue for training facilities only. B. Maintain current knowledge of veterinary practices, techniques, and regulations. C. Replace initial certification requirements. D. Eliminate need for on-the-job training.